All right. Good morning, everyone. Thank you so much for being here this morning. I am Miranda Berger. I'm the Director of Programs with Olympic Community of Health, and I'm joined today by Celeste Schoenthaler and Lauren Garrett, also from the OCH team. We're so glad for your interest in this funding opportunity. It's really nice to see some familiar faces on the call, or names if you don't have your camera on. And it's also so nice to see some new names and faces as well. Before we get started, we're recording today's session and we'll make the recording available on the FAQ document so that everyone has an opportunity to review and watch that, even if they weren't able to be here live with us today. We're also going to take the questions and answers from today's session, and those will get updated to the FAQ as well. So you'll have, if you feel the need to frantically take notes, all of that will be captured and added. We're not going to do a round of introductions for the sake of time because we want to make sure that most of this hour is spent answering your questions. So you're welcome to pop your name in the chat to introduce yourself to the group if you would like. I've posted in the chat a few times and I'll post it again. The link for all of the materials that we'll be talking about today is there if you'd like to follow along. And I'll also pull up my screen and share that here in a moment. So our plan for this hour is I will walk through the funding opportunity documents. I'm hoping that doesn't take too long so that we can leave most of today's call to let you ask your questions and have some discussion. You might have some questions that we're not able to answer today, and we'll let you know if that's the case and ask for your patience as we get back with you in a couple of days. And like I said, we'll be sure to update the FAQ so that everyone has access to those answers. So with that, I'm going to dive right in and share my screen. Give me 1 second while I get situated on the screens. So like I posted in the chat a few times, the link for all of the documents we'll talk about today can be found here on the OCH website. It's just olympic.ch.org/funding. And there are 3 materials that we'll walk through today. An overview and instructions document, a application, which is a Word document that you download, and then the frequently asked questions document. So I'm first going to navigate to the overview and instructions document and walk through that for you. So this is the place that introduces the funding opportunity. It outlines the requirements and the process as well. I'm not going to read this line by line, but to go over some of the key points in here. The purpose of this funding opportunity is we're seeking to contract with partners throughout Clallam, Jefferson, and Kitsap counties for community-based care coordination services to identify.
Miranda?
Yes.
Would you, just for the people who are a little older than you, would you just make it a little bit bigger?
Yes.
Thank you.
Is that better?
Yeah. And I would, people can pull up the documents live on their computer as well.
Yes.
Who are you referring to, Celeste?
Myself, Mike. I was referring to myself.
Yes, thank you. Thank you, Celeste. Feel free to interrupt me if I need to make any other adjustments as we go. So as I was saying, we're seeking to contract with partners throughout the Olympic region for community-based care coordination services to identify, respond to, and address social needs for those who live, learn, work, or play in the Olympic region. So there are 2 different care coordination models under this funding opportunity: full service, and the second is care coordination for those with more complex needs. And just shortly, I'll go more in depth into those 2 different models. I see some new faces on the call, so just briefly, what is Olympic Community of Health? We're a nonprofit serving the 3-county region of Clallam, Jefferson, and Kitsap counties, and we have partnerships with the 7 sovereign tribal nations in the region as well. And our goal is to improve individual and population health and advance equity by addressing the determinants of health. And our website is linked here, so you're welcome to dig a little deeper and learn more about our work. This funding opportunity is connected to our new initiative, which is Olympic Connect, and Olympic Connect is expected to launch in early 2025. Olympic Connect is what we are calling our community care hub. And a community care hub is a community-centered entity that supports a network of partners providing services and resources to address social needs. We aim to add value throughout the region by creating a more coordinated, systemic, and data-driven approach to how we address social needs. And when I say social needs, we mean things like housing, job training, food assistance, healthcare, childcare, and the list goes on. We know that when we help community members to address their social needs, that we are helping our communities to thrive and helping people live their healthiest lives. If you would like to learn more about Olympic Connect, there's a link here to a nice article that offers more, including a recorded video by Celeste, explaining a little bit more about the what and why of this work. So as I mentioned before, through this funding opportunity, we aim to identify health-serving partners throughout the region interested in collaborating to build up a region-wide system for providing those care coordination services for individuals seeking support with their social needs. We anticipate that we'll support between 18 to 25 members of the community-based workforce through this current funding opportunity. When I say community-based workforce, that's a broad term that's used to identify the on-the-ground workforce that helps connect people to the resources, services, and supports they need. So that includes many job titles, including community health worker, care coordinator, case manager, peer supports, and on. Like I mentioned before, there are two models for community-based care coordination under this funding opportunity, and partners will apply for one of those, and I can show you what that looks like in the application here shortly. The first is full service, and this provides a snapshot of that scope of work, and linked here is a review of the full scope of work for each care coordination model. For full service, the big difference to highlight here is that this includes proactive outreach, engagement, and identification of potential Olympic Connect clients. And largely the other pieces of the scope of work are similar between the two, including hire, train, develop, and engage the community-based workforce, supervising that workforce, implementing care coordination services in adherence with OCH protocols and best practices, learning and convening, contributing and updating a regional resource directory, reviewing, signing, and adhering to all the associated policies, data and reporting, and surge or emergency support. And the purpose of full service is really to provide that care coordination service for clients who are identified as having low to medium social needs, which is why this includes that proactive outreach. For complex needs, this is for those who require more intensive and or longer term support. So we anticipate these clients may be managing both health and social needs. And again, you can link here to the full scope of work. And the big difference here is that this scope of work does not include the proactive outreach and engagement piece. Scrolling down a little bit, looking at eligibility, eligibility for this funding opportunity is organizations, tribes, and governmental entities in Clallam, Jefferson, and Kitsap counties that are working to advance health through collaborative action. Applicants must be in good financial standing, have a presence in the Olympic region, and be an established legal entity in Washington state. Olympic Community of Health will provide robust training and onboarding for those who will provide the care coordination services. We also offer a variety of learning and convening opportunities. We will provide access to cloud-based regional technology to do the centralized management of the client intake, screening, referral, progress, and discharge processes. We'll also provide access to a regional resource directory platform. We'll provide structure for the system, including referral and assignment management, workflows, policies, and procedures. We'll provide technical support and overall project coordination and communication. We also provide contract monitoring in alignment with funder, state and federal policies and in accordance with the approved scope of work and budget. We provide ongoing training, community building, and capacity building for the community-based workforce. We'll also provide the data analytics and reporting under this, and OCH staff will provide backup care coordination services as needed. We want both care coordination models to be available throughout the full 3-county region. So in the application, we are asking partners to identify which subregions they are able to provide services in, and it is very, very expected that partners will not be able to service all 7 of the subregions. And that's one of the considerations that OCH will be making when we make funding decisions is where folks are able to provide services. So this, what you select should align with your capacity and natural service area. So we've broken the 3 counties into these 7 subregions based on what we've heard from partners tend to be natural service areas. The funding will largely be cost reimbursement based, and partners will be asked to submit regular invoices for review, approval, and payment by OCH. Each care coordination model has a slightly different up to amount. So for full service, it's up to $140,000 per 1.0 FTE, and that's prorated for a 12-month period. There is a requirement to have at least 0.5 FTE under this. And in the application, partners will propose how many FTE they would like to have up to carry out the scope of work based on any limitations to services you can provide, what type of care coordination you anticipate providing, and the service areas that you'll be operating. OCH will provide an initial payment upon contract execution and then move to cost reimbursement via monthly invoice submission. This call out box here details more about what eligible expenses are included in this. So salary and benefits for the community-based workers and their supervisor, in-region travel costs, supplies, phone and phone plan, computer or tablets, internet hotspots, outreach materials, training and professional development, and admin and interact. And then if there are additional expenses, OCH can review those on a case-by-case basis. This is our timeline. So today we're here, August 15th. The FAQ document has been available and will continue to be through the deadline, which is September 10th, 5 p.m. You will submit applications to connect@olympic.ch.org. From September 11th through 16th, OCH staff will review and score applications, and then by September 18th, applicants will be notified of their status. Those receiving high scores will move on to the next stage of the application process, which is a virtual interview with OCH. And that will take place the week of October 1st through 4th. And then on October 14th, the OCH Board of Directors will make final funding decisions and will move forward with the contracting piece. The contract start date is November 1st, and if contracts are signed afterwards, they can be backdated to November 1st. We anticipate starting partner onboarding and training under this funding opportunity in mid-November. I'll pull up the application here next. These are the elements and how each application will be reviewed and scored by OCH staff. So the first element here is care coordination, collaboration, and community-based workforce. And these first 3 apply to both of the care coordination models. And then the last 2 are depending on the care coordination model. So for full service, the 4th element is outreach and engagement expertise. And that's not an element that we consider for the complex needs because that does not apply to their scope of work. So for complex needs, it's the complex needs expertise. So a total of 4 different elements that each application is evaluated on. So OCH staff will review and score those. Those receiving high scores will be invited to the second phase of the application process, which is that virtual interview. OCH staff, in making recommendations to the board of directors, will consider both application and interview scores, the geographic areas that each partner can serve, any limitations to their services, and the type of care coordination that partners would like to implement. And then the board will make final funding decisions. As I mentioned before, it's anticipated that OCH will support between 18 to 25 community-based workers through this funding opportunity, and that's across all 3 counties. If you have questions after today, like I said, the FAQ is available. You can also email connect@OlympicCH if you have questions that can't be found there. Here we've outlined some contract requirements that we have in an effort to aid in transparency and clarity. And the deadline to submit applications is September 10th by 5 p.m. And I'll pull up the application here so you can see it. Let me make this big again before Celeste tells me to. 150, is that good enough? So like I said, on the website, this is a Word document that you will download. And you can just type directly in this form. We ask that you please don't delete anything in the form. We will do a technical review as we receive applications to ensure that they're fully complete, and we may reach back if additional information is needed. The first section is fairly straightforward. Question 4 here is where you will select which care coordination model you are applying for under this funding opportunity. Question 5 is where you identify the subregions you're able to provide those care coordination services, and you would select all that apply. Question 6 is where you would list any of those limitations that you have. So for example, this might be if you can only provide care coordination for specific social needs, or if there are types of clients that you can serve, or if you can only serve clients who are already enrolled in your services, that would be where you would list that here. Question 7 is where you would list how many FTE you propose funding under this model, and then briefly share just your rationale for this number. And then question 8 is the attestation that the signing authority understands the funding model. And then the other thing I'll highlight here, everyone will fill out sections 1, 2, 3, and 4. And then sections 5 and 6 you fill out depending on which model you select. So if you select full service, you would fill out section 5, but not section 6. If you select complex care coordination model, you would fill out section 6, but not section 5. I'll quickly just jump over to the FAQ document so you can see this is available. It's linked on the website. We're updating this at this point almost daily. Probably on Monday or Tuesday of next week, we'll be able to add the recording link from today's session, and we'll also be working to update this document from all of your questions that I anticipate you're about to ask now. So with that, Celeste, is there anything important that I've missed that you would like to highlight before we jump to questions?
No, nice job, Miranda. I just put a note in the chat that we are not requiring a budget as part of the application. So the only document you need to submit to us by September 10th is the application document. And Miranda went over the list of eligible expenses. So we don't need you to do anything more than that at this time.
Thanks for adding that, Celeste. I'm gonna, so we can, we'll jump into questions now. I'm just for the sake of organization and to make sure we don't miss anybody, if you can go ahead and use the hand raise function, and we can then address your questions in order and make sure everyone gets a chance. You can also type in the chat if you'd like, and Celeste and Lauren can help me monitor that so that we don't miss anything. So I'll just give a minute for folks. If you have a question coming to mind, you can find that hand raise function. I'm going to stop sharing the screen for now, and I can pull documents back up if that's useful.
I just know it's not a perfect funding opportunity, so this is a really good chance to let us know what's coming to mind. But there you go, Miranda.
Thank you. Alicia is asking, can you give an example of more complex needs? And you're referring to the complex needs care coordination model, Alicia. Yeah, so these would be based on people who are screened as having high social needs, meaning like lots of lots of social needs selected, where it might be hard to prioritize what to work on first, or if those social needs are really interacted. And then we also anticipate these would be individuals with perhaps both social and health needs that are also very, and the word is I keep saying interactive, but that's not the right word. Whatever the word is I'm looking for there.
Miranda, let me hop in there. I think
Thank
we before the contract starts, we will develop some criteria internally. I think there will be some level of subjectiveness to that, Alicia, but we are going to develop some criteria for when clients get referred to the hub. But I think some other examples are, people who are coming out of a carceral facility, people who might have both clinical and social needs. So maybe they're without a home or a safe place to sleep at night, and they also have maybe like a mental health disorder, a substance use disorder. But we will have like some objective criteria before the contracts start for that.
Thanks for adding the examples, Celeste. I'd also add to that we will work with the selected partners under this funding opportunity to create the assignment criteria that aligns with partner capacity. So as you list out the service areas you can serve and any limitations, that will then inform the assignment criteria. So as we receive referrals, we can be appropriately assigning them to people that you're most suited to work with.
Kelly Parcher, yes, we would ask that you submit 2 different applications. You asked if somebody can apply for both. We would just have you do that in 2 separate applications because we're considering those in a little bit of a different way when we make our decisions. We would have 1 contract with you, but we need 2 different applications. Mondana, Miranda, there's language about this in the funding opportunity in the overview document. I don't remember what I said, but it'll start out, the initial time period is November 1st of 2024 through December 31st of 2025. So the initial contract period will be 14 months. So that up to dollar amount will be prorated for 14 months. And then I believe in the document, we say that there is the possibility of extension for up to 3 more years. It might be 2. I don't remember what I said in there. But that will be based on contractor performance. It will be based on our funding and the needs of the community care hub.
And the section Celeste is referring to is here on page 5, underneath the timeline table. Julie, I see you have your hand raised.
Hi, thank you. I apologize if this has been answered in another way, but how are clients referred? What is that referral process? How are they referred to the hub? And then I'm assuming based on what you just said about those are then referred from the hub to the appropriate clinician or the organization in that area. But how are they referred to OCH?
Yeah, we'll have referrals flow through several different ways. One way that we've heard this talked about is like the no wrong door approach. So there will be an intake form that can be submitted online or could be sent to us a different way if that's needed. So individuals can self-refer, partners can refer. We're going to be working with our local partners who are natural referral sources. So hubs that are already taking place, partnering with those natural areas where people are getting connected, and then accepting those referrals through a variety of modalities, recognizing that not everyone has equitable internet access and might need other ways to do that. But there'll be an intake form that gets filled out, sent to OCH, and then OCH then inputs that into the cloud-based technology and works with our contracted partners to get that assigned to somebody, the community-based worker that's best suited to work with that individual.
Thank you very much.
April?
Hi, I'm wondering what training and onboarding with OCH looks like for the organization.
Yeah, so that it's we're in the process of developing what that'll look like, and we're sure our partners will help us. There will be, we anticipate around like 20 to 30 hours of onboarding and training that will happen, and that includes sharing with the workers, starting kind of at a high level, like what is this work about, how does it work? And then starting to get more specific and in the weeds of introducing them to the cloud-based technology that they will use to do the documentation, reviewing the policies and procedures, and also then the best practices that go with the care coordination, and the tools that we have available to support them in this work. It'll likely be a combination of in-person training and onboarding as well as some virtual.
So that's what the representatives from the organization will be doing, is using this cloud-based technology for documenting invoicing? Or are you saying that that's what OCH will be training and implementing for the organizations?
When I say training and onboarding, we mean specifically for the community-based workers. So the cloud-based technology that they will use to document the work that they do with the client. And then there's also a resource directory we have available for them to use and help add to and improve. The invoicing processes are not a piece of what I'm talking about there, but we definitely will offer orientation to appropriate staff on how the invoicing process will work, but we anticipate that's likely different staff than those who are providing the care coordination. Mike?
Thanks. And great presentation, Miranda, and the documentation is really clear. So thanks for putting that together. This might relate a little bit to Julie's earlier question, but is it fair to characterize the funding as supporting both the community-based workforce that identifies and refers people into the hub, as well as those that receive referrals from the hub to provide services? Is
Yes,
that fair?
Yes, especially under the full service care coordination model, where the outreach and engagement piece is a part of that scope of work, to be out in the community, identifying potential hub clients and bringing them in to get connected.
Great, thank you.
Celeste, I haven't been able to manage the chat, so can you help me look back and see what questions we've missed?
I've responded to everybody in the chat. And if anybody has any additional, sometimes chatting doesn't get all the nuance. So if anybody has follow-up questions to anything that I've replied back, please let us know.
Okay, great. Julie, I see you've got your hand up.
Sorry, thank you. So this is probably going to feel pretty superficial, but I'm trying to figure out what is the actual application that we're looking for in terms of somebody is approved. What does a day in the life look like? So the hub gets a referral, an intake referral, then you guys piece that out to the most appropriate organization. Can you just help me understand what that application looks like, the application of the work on a day-to-day basis? So the community-based workers are going to the community, obviously trying to find the client that needs the resources and the support that may be hooked up with other organizations.
Yeah,
may
so
not
when
be.
you, so you, Julie, you're asking to paint a little bit of a picture of the day in the life for the community-based worker under this scope of work?
Yes, thank you.
So that I think it could look different depending on the organization or tribe employing that community-based worker, but at a super high level, that would look like a combination of being under full service, being out in the community, either at events or going to find clients in hard to reach places, to do that outreach and engagement piece. And then there's also likely some needed like desk time to do documentation in the cloud-based technology. And then that coordinating with your clients. So that could be by phone, it could be in person, of assessing what their needs are, using motivational interviewing and other best practices to help them set their own goals and priorities, and then working with them to create what are the action plans that we want to implement to reach those goals, and connecting them via warm handoff, and closing the loop on needed referrals and resources. Does that help, Julie?
Yeah, thank you.
Stephanie?
Hi guys. I just I'm out on the West End, fully operable, got the license and everything for the building that we need to practice out of it as far as reflections goes. But I have the real program out there and looking for an additional, I hope, and apply for this funding for additional program. There's not any like outreach type work out there. And unfortunately, Real Team has a real strict, it's this and this and this, and that's it. And we get a lot of referrals in. Is this the funding that I would apply for to fill in those gaps of services out there?
So I think that's what your question, I'm not going to directly answer your question, Stephanie, because I think it's pointing to another piece I want to highlight of that this is to provide care coordination specifically for Olympic Connect clients. And so that may or may not be the same population that is served under other care coordination efforts that you have going on, like the Real Team. So I think that's an important distinction, that this isn't just for care coordination that duplicates other work that you're doing or to supplement funding that's already in place. This is specifically to provide care coordination for Olympic Connect clients.
Yeah, a whole new program is what would be built. Miranda, just wondering, there's a lot of referrals that come in out there that don't ever get served because they just don't fall under Real Team, and there's no other agency doing any of that work out there. So really want to just come to that West End, and the West End is going to be all of Clallam and the tribal out there, so it's including all Clallam County out there when you talk about this region one.
Yeah, so when you look at the sub-regions in the application, Stephanie, we do specifically call out areas of the West End, and it's an area that we definitely want to make sure that we're able to provide care coordination services to under this.
Okay. Thank you.
Yes, Alicia.
Just to piggyback off of what you were just sharing with Stephanie about that this is specifically for Care Connect clients. Do you guys have a definition of who would qualify for Care Connect so that we can better know whether, I guess I suspect that most of my clientele is going to fit into that bucket, but also I don't totally know what are the parameters.
What are the eligibility requirements? And you said Care Connect, Alicia, but I think you meant Olympic Connect. Care Connect is a different care coordination program that we were helping with a while back. So yeah, we've said that the hub will serve anyone in their with no eligibility requirement. So there's not an insurance requirement. This is a free service that is available. And when I say free service, I mean like getting connected to Olympic Connect and getting assigned that community-based worker for the individual. The resources and services that they are then connected to may still have costs associated with them, and a future funding opportunity that OCH will be releasing is focused on trying to expand the resources and services that we will be connecting individuals to, recognizing that there are not enough to meet the needs right now. Yes, Mike.
Yeah, so we're currently looking at signing up and getting certified with FCS and wondering how or if there is any duality between clients that sign up with FCS because they're specific within the guidelines of what that looks like, and then how that would can they sign up for Olympic Connect as well, or if they sign up for Olympic Connect, is that the service for a state?
You're cutting
that
out
make
a
sense?
little. You're cutting out a little bit, Mike. I think I got most of your question, but please correct me if I miss a piece of it. So there would not be like a concern that if somebody's already engaged with FCS, that then they would be disqualified from connecting with Olympic Connect. The way I view that relationship is that FCS is considered, I know that has some case management attached to it, but that's more of a service for those specific needs. If somebody is needing the employment support or the housing support, that would then be a service that Olympic Connect could connect somebody to and work closely, having those people providing the care coordination service working really closely together and communicating with. But at the outset, there wouldn't be like you're in that program, so you can't do this program.
Didn't mean to raise my hand again. And then if it cuts out, I can just do it in the chat. But within that model, if we are serving both the Olympic Connect and FCS model, and there might be referring people back to the same location. Just a thought.
I think I missed the most important point of what you were trying to say, Mike.
All right, I'll chat it.
Sorry.
I put several chats ago, I put a link to it seems like it's kind of got buried. I can repost it, but on August 27th at 9:00, we have a virtual coffee hour that's open to anybody who's interested in learning more about Olympic Connect. I know we posted the blog in the overview document, but that might be an opportunity for some of you who are trying to better understand the big picture of Olympic Connect. I can repost that again too. It's in the chat.
Thanks, Celeste. And Hannah, I haven't been able to monitor the chat closely, but I think Celeste has us caught up to Hannah's most recent comment of, do existing co-responder programs have to switch over to your documentation system or do double documentation? That would be up to the program to decide whether or not they want to switch or do double documentation, but we will require that partners use our technology for documentation. Stephanie.
I know that some EHRs require you to be agency affiliated. Is there going to be a special requirement that or certificate from like healthcare authority or anything that they're going to have to access the system?
There's not a certificate. You will have to sign the associated policies and procedures as a part of the contracting. And that includes like privacy and data security policies.
Okay, awesome. Thank you.
And Stephanie, I know why you said this, but I do want to clarify, it's not an EHR. It's a cloud-based technology that is EHR agnostic.
And it's also not a healthcare authority system. It'll be owned and operated by us.
Other questions coming to mind? Madison?
Yeah, so I was looking at the caseload. It says that partners will manage a caseload of 40 to 50 clients. Is that 40 to 50 per CDW or is that per organization?
That's per 1.0 FTE. And
Okay.
I want to just clarify, like, that's a best guess at this point in time.
Sure.
And we're really committed to working collaboratively with our partners to determine like what does feel like appropriate caseloads. And that is why we've written in there that OCH will serve as backup support as needed for care coordination services, so that if partners are at capacity and due to complicated cases or cases that just can't get resolution or are taking more time, we'll work closely with partners on those pieces. So it's not a hard and fast number. It's more of our best guess at this time.
Great, thank you.
Any other questions? So the frequently asked questions document is up. We will work to get a recording uploaded there and to update it with your questions from today. You can always email connect@olympic.ch.org with individual questions. Between now and the deadline, we'll be responding to those. I'll go ahead and leave this open in case anybody wants to hang on and ask a specific question. Otherwise, we can end here and just again appreciate your time and your interest in the funding opportunity and look forward to hearing from you all. So thank you.
Thanks, Miranda. Thanks, Celeste.
Hannah, I see your question. I don't know that I fully understand it. So if you want to come off mute and ask, I'm happy to chat, try to get you an answer or decide to connect back with you in a day or two.
That's what I was gonna say too. I don't think I fully understand your question.
That was Hannah's my assistant. This is Gabby. I don't have enough service where I'm at.
Oh, okay.
Ask properly, but my question would be like CARES has a very specific, you have to have a 911 nexus to get into the program. Like we can't just take referrals from anybody that calls. Would we then have to expand and take referrals from the Care Hub that you guys are proposing?
Gabby, there's a question in the application that asks you to say like what your limitations are.
Okay.
So you would explain that in the application. So like if you are saying you can only serve like X demographic or X type of person or something like that, there's a question about that in the application because we know that's pretty common. Like for example, just because I see Mike's name on the screen, my assumption is that North Olympic Healthcare Network could only serve North Olympic Healthcare Network clients. People who are like on their patient rosters. And I also see Alicia's face on the screen. And my assumption is that Alicia, because her focus is early childhood, that her focus would be early, families with younger kids, and she couldn't serve seniors or something like that. So we just need you to tell us about that in your application.
Thank you.
Thanks, Gabby. Julie, I see you have your hand up.
Hi. Yeah. So promise, last question. So in terms of looking at a caseload of 40 to 50 and then getting those referrals through, is this for more longer term case management, or so for these are people or clients that are not connected, that need some additional support? Are we then acting as that referral source or hub and then transitioning them onto more longer case management? So for example, here in Kitsap County, if they need ongoing behavioral health, I might refer them to either KMH or PCHS for more longer term resources. Or is the expectations that we be that person to do that ongoing case management?
So the intention behind full service is that this is not long-term case management, and that's where some of that priority setting and goal setting with clients comes in to address the social needs pieces. So I think it's important to come back to the intention is to provide the care coordination for social needs, is in recognizing that there obviously people come with both and they don't separate, and we can address some of that, but the primary focus here is social needs. So under full service, I've heard other hubs across the state talk about an ideal window of service between 3 to 6 months of providing care coordination services. And that's why we also have the complex needs for those who might be more longer term, and in addressing their primary complaint or need around social needs. If somebody's primary care coordination then starts to fall under something more clinical like behavioral health, then we would look at connecting them with another care coordination service like through KMH.
Okay, thank you. Appreciate that.
All right, if there's no more pressing questions, I'm gonna stop our recording and end our session, and welcome to email if you have additional questions. Oh, I see another question, Anita. How about childcare programs that are seasonal but recurring? I'm not sure I fully understand that question.
Anita, can you come off mute and share a little bit more?
Okay, hey, yeah, I'm trying to. No,
Oh.
thank you. Yes, so my question is if actually our program would be eligible for something like this. We are a brand new summer program in a low-income area, and we support local families and children and their parents. And this is, so my question is if a program of this kind would be eligible to apply. And it's, it's a program that lasts for 2 months in the summer. And we hope, for it to reoccur every year. But it's not something that, is a full-time, long-term program, 12 months a year.
I think we need to think about that, Anita, and get back to you. I don't think we had talked through that yet as a team. So let Miranda and I talk over the next couple of days, and we will put a response to that in the FAQ.
It would be great. Thank you so much.
Okay. Yeah. Thank you for raising that. It's just not something that we had thought of yet. So.
Okay, great. I'm glad I asked. Thank you.
Is this an okay time to ask specifically if my organization would fit with what you are all looking to fund, or should we set up a separate call? I don't want to.
No, please.
Okay, so I am with Olympic Angels and we serve the foster care community in Clallam and Jefferson Counties, subregions 2 and 3. And I'm trying to decide if we fit into this full service or complex service at all, first of all, and then if so, which one would be better for our organization?
Can you share a little bit more about what it is that you're doing that's around care coordination?
Well, maybe that's a better place to start too. I'm not exactly sure how you define care coordination. I mean, we are referred families, they either self-refer, they come through DCYF, they come through the school system. And we have 2 programs that serve families who are fostering and then a one-on-one mentorship program for youth in care. And so it can be ongoing as the complex category would allow for, because foster care does that, but it's also very fluid and it can be short term. So do we fall within that care coordination model at all, or I guess I'm having trouble trying to identify with exactly what you're looking for funding.
So April, I think my hunch is that you would. I think you would in that question that I was talking about a few minutes ago, you would probably tell us like you could only, not only, I don't mean to say that, but like that you would be okay with serving youth within the foster care system who are, you know, connected to your agency, or however you probably have a better way of describing who your clients are. So what this would do if you were to get funded and say you requested a full-time community-based worker, then you would either hire, I'm making some assumptions here, but you would hire a community-based worker who would sit within your organization. I mean, there would still be this and if you said like you could only serve clients that get connected to your organization, they would still have to come through you'd still have to work within our technology, but then you would have a person in your agency who could be dedicated to connecting those clients to resources and services to get social needs met. And perhaps you already have employees like that. And then in that case, we would pay for that person's time instead of whatever other funding source you're using now. Does that make more sense?
I think so. We have
Okay.
3 full-time case managers, and when clients come to us, I mean, they just go through our own referral system that we have. But I see operating with OCH as an opportunity to reach more families that we can't reach, and then for them to find us as well. So I definitely
so
see.
you'd want to describe that in that question about who you could serve then.
Okay. Okay. And then to that end, would it be complex? Is that where you think that path goes?
I would keep in mind that this is social needs. That my hunch is that it sounds complex, but I also want to make sure that like if part of what your current case managers do is connecting to clinical care or I mean something else, like that would still be on your dime, on your own time, that this would be like, if we're working to make sure that those youth have access to healthy, fresh, affordable food and transportation and those kinds of things. Like it just kind of depends. You probably know best. And so we're asking you to tell us what you would apply for. And then if you get to that phase where we're having the interview and we understand your organization a little bit better than I do without reading an application, then we can have that conversation about what might fit best. But I wouldn't stress about it, that part too much. I would just, write the application with your expertise and go from there.
Okay, and just with the knowledge that we do have 3 case managers in-house, and as we grow at a very sustainable rate, right? So we need to make sure that we can fund them as we can grow, and then they can take on more cases. But I would say each of these case managers only have about 15 on their caseload, 15 either families or youth in care, but those families can have, up to 9 people in their family at a time. So does the caseload worry you at all, that we kind of already know our limitations on that?
That doesn't feel off to me, April, because the caseload, when we say caseload, we talk about individual. So if in fact you were servicing a family of 9, that would be a 9 caseload.
Got it. Okay, thank you.
Anything else? Okay, I'm gonna stop our recording. I'm still, April, you're just gonna see behind the scenes for a minute if you hang on.
Miranda, I saved the chat.
Oh, I did too. I was just like, I'm
Okay.
just double checking before I hang up. I saved the chat. I can just end the meeting and that saves the recording.
I don't know.
Okay, I'm gonna stop